So if there is no qualified pharmacist, university graduate in pharmacy, it cannot be a pharmacy. The pharmacist is a long life learner. If you always apply them in your practice, you discover that you will really be the society's #1. And people will also recognize your profession. Tetanus toxoid vaccine. In some places, you see people keeping these things in the sun. Of course, those laws would have even expired before the expiry date.
All right, welcome to the Community Pharmacy Accelerator Show. It's another beautiful day, another wonderful episode for us to grab so much that can inspire us to do better in our practice. And of course, I'm your host, Pharmacist Joseph, also known as MC Dr. Spice. And today we'll be talking about practicing clinically in the community pharmacy setting, okay? And of course, we would like to share today the gains of clinical pharmacy practice in the community setting. And today we have a guest. I'm not going to let the cat out of the bag, but I'm sure there is no other person to fit into these shoes today than the #1 clinical pharmacist himself. And I'm going to let him, as usual, introduce himself on the show. Welcome to yet another wonderful edition, another episode of the Community Pharmacy Accelerator Show. All right, so welcome, sir. Welcome to the Community Pharmacy Accelerator Show. You're looking wonderful and clinically oriented. All right, so sir, please, we'd like you to introduce yourself so our viewers all over the world can get to meet you.
All right, thank you, Joe, for having me. Well, my name is simply, I am addressed as Dr. Joseph Madu. I'm a fellow of the West African Postgraduate College of Pharmacists and a fellow of the Pharmaceutical Society of Nigeria. I'm also the managing director of CDIT Pharmaceuticals in Port Harcourt, as well as the national chairman of the Clinical Pharmacist Association of Nigeria. So that's simply all about me.
Wow, that's amazing. All right, so you heard it from the horse's mouth. We have in our midst today Dr. Joseph Madu, the man who embodies clinical pharmacy practice himself. All right, we'll go on a commercial break and let's get to tell you about those behind this wonderful show. And when we're back, we will continue. We will unravel what we have for you in this episode. Stay tuned.
This episode is proudly supported by New Heights Pharma Limited, official business partners for Omron Healthcare Europe, and the owners of the Health Check brand in Nigeria. Do you know that with just one test cassette, you can get tested for HIV, hepatitis B and C? Oh yes, with the Health Check Triple H viral test cassette, knowing your status is easy and stress-free. It is simple, quick, reliable, with over 99% accuracy. Order for your pack of Triple H viral check test cassette at the pharmacy near you today, or call the number on your screen.
Okay, sir. That was a wonderful introduction. Although you forgot to tell us that you're a knight of. I know there's some "sir" in your name, anyway, in your titles. But let's get to ask you, how does it feel being a community pharmacy all this while? What is it to you? How do you feel?
Well, I have practiced for at least 20 years now. I started practicing, yes, of course, in the year 2000. Year 2000 was when I started, opened my own community pharmacy practice. And I must say that it is highly fulfilling to practice in the community. You know that the pharmacist himself is a medical professional, and pharmacy practice differs in some ways. Of course, we know that the pharmacists are the makers or producers of medicines. But besides that, pharmacists also practice in different settings, including community pharmacies, hospitals, nursing homes, physicians' offices, clinics, and what have you. So community pharmacy itself, all over the world, is known to be the first point of care. It's the first point of call for many members of the public. Most people go to the pharmacy first, and probably the pharmacist can handle their case, or sometimes may refer them to the hospitals. And you know that in the hospitals, there is also pharmacy practice in the hospital, but they are not the same. The hospital pharmacy practice is not exactly the same with what happens in the community, even legally. In the hospital pharmacy environment, the physician, for instance, is usually the first port of call. Every person that comes to the hospital must see the physician, for instance, before even getting to the pharmacist or other healthcare practitioners. But in the community, the pharmacist, in most cases, is usually the first point of call. People go to the pharmacy first. And this happens all over the world. So it's highly fulfilling. In our country, for some years now, I think before really the advent of clinical pharmacy, people may go to the hospital and sometimes they may see a pharmacist operating through the windows, what we call window dispensing. Yeah. So that really creates a barrier between the pharmacist and the patient. Of course, that for now is already obsolete. Anywhere that is practiced now, we term that as archaic pharmacy practice. The pharmacist should really be close to the patient, and that is the way it was. But in the community, you don't have that barrier. You find the pharmacist, you have your patients, and you can interact with them one-on-one, establishing a better pharmacist-patient relationship. So I can tell you that it's highly fulfilling, and you can do a lot for these patients, and you feel very, very happy that as you practice your profession, you can serve these patients, and what you give them, they can also come back to you and tell you how far it has gone in terms of taking care of their health conditions. And in many cases, you find out that the patients are getting well and they are grateful to you and to Almighty God. So for that reason, you see that community pharmacy practice, is slightly different from probably practicing in the hospital. And then you feel much more fulfilled because you see your patients. And you introduced me as the number one clinical pharmacist in the country. Of course, you are right, since I'm the national chairman of clinical pharmacists in the country. But then I want to say something. The person who introduced clinical pharmacy in the world, I think is a pharmacist cum physician. And it was said that was where clinical pharmacy began. Actually, it was in the operating theater where he was about to operate his patients, and then he allowed pharmacy students to see the stages of anesthesia in the patient, because you cannot do surgery without inducing anesthesia. So the pharmacy students were able to see the stages, or what they learn in the pharmacy school, how the stages of anesthesia take place and how anesthesia is being induced in this patient before surgery can take place. So the pharmacy students were seeing the patients. It's not maybe being taught in class and then there is no physical experience. So I can say that even in practice, as you are closer to your patients, you feel fulfilled, yes, and whatever you do, you see it, whether it's working or it's not working, you can review it and do it better. And then that interaction, you can also collaborate, even while in community practice, with the physicians, the nurses, the dentists, and other healthcare professionals. Wow. Thank you.
Wow, fantastic. So, sir, let me ask you, so far so good, what are some of those lessons that practicing community pharmacy has taught you? that you can share with our viewers? And I ask this question because our viewers, some of our viewers are people who are just starting, people who are just into community pharmacy, people who definitely want to leverage on some of the experiences, some of the lessons that those who have gone before them. I mean, 22 years is not beans. It's not, like we say, it's not beans. It's not mean feat. So I'd like to know, what are some of the lessons that practicing community pharmacy has taught you?
Well, I will say a lot. I have learned a lot, which I may not be able to, list even up to 50% of the lessons. But then the first very important thing I realized in practicing is that there is poor perception of who the pharmacist is by the public and even some persons in government. Remember that the government is formed from the society. Yes, and like I earlier said when we started, that the community pharmacy is the first point of call. There is this belief that everyone knows that the society feels that the community pharmacy establishment should be a sort of primary healthcare center. If people use it as first port of call, then that means it should be a primary healthcare center where people go and get well. But unfortunately, the perception is still not at the level of seeing it as a primary healthcare center. I know that the federal government has not really brought it to that stage, but then with the Pharmacy Council Law of 2022, the community pharmacy is already defined as a healthcare facility, meaning that people can go and take care of their health there. So it means, yes, we are getting to that point. But as I said, the public perception is still very poor. Most people see the community pharmacy as a place where drugs are sold. So the moment there are drugs there and drugs are being sold, they call it a pharmacy.
Okay.
And even the people that work there are regarded as pharmacists.
Not necessarily.
Yes, and they are not trained. Yes, they are not professionals. We know that.
They just support staff.
Yes, we know that to be a pharmacist, you must have gone to the university. There is no way you can be a pharmacist without being a university graduate. You must have attended pharmacy school to graduate with either Bachelor of Pharmacy or Doctor of Pharmacy degree before you can even be a pharmacist. So it's not something you go along the roadside and become pharmacist, or something that whoever is seen, yes, in a place where drugs are kept, you call the person a pharmacist. Remember, we usually say that it is not the presence of, or it's not the size of a church building that makes it a cathedral, but the presence of a bishop. So if there is no qualified pharmacist, university graduate in pharmacy, it cannot be a pharmacy. But unfortunately, most people still, even some educated Nigerians, sometimes we tell you that they got into that market and they saw the pharmacist there. Of course, a pharmacy cannot exist inside open market.
So that's about perception.
Yes.
So what other things, like in the course of your practicing, what are the other experiences that you also like our viewers to, pick? Like, what are the kind of things you encountered in the practice that, that changed your mindset about practice, things that they will learn from, basically. You've talked about them seeing the perception people have that anybody in the pharmacy is just a pharmacist. So what other striking things? I know you may not remember all, but some other striking things that you learn, people can learn from your experience.
Yes, one thing I can say is that if you are practicing very well, if you know your onions, and those things you really learned in school, and you learned even after school, remember the pharmacist is a long life learner, And as it is said, the moment you stop learning or reading, you start dying. So in the course of your practice, all that you learn, if you always apply them in your practice, you discover that you will really be the society's number one. Yes, people will see you as number one, and you will get fulfilled. I'm saying this, that even financially, you will still get fulfilled. It's not that pharmacy is all about money, but because you're offering services according to the Holy Book, a laborer deserves his wages. So you even feel fulfilled, and people will be ready to pay for your services simply because of what you know. Knowledge. It is commonly said, yes, what you know will put food on your table. And that thing you know, not only putting food, the fulfillment comes because it makes the society better. People will get well, people will feel fine, and people will also recognize your profession. So all you learn, if you can put it, and in community pharmacy practice, you discover that these are the kind of things that this is the experience that you get. I was trying to say something initially. For instance, most people that go to community pharmacies, they may ask you that they don't want an expired drug. They may tell you that they will be looking at the dates, expiry dates. But as a pharmacist, you know that even the storage conditions of a drug is even much more important than the expiry dates. Because we are all in school, we learned chemistry and the rest of them. We learned how one chemical can be converted to other, even through heat and through other processes. So the fact that a drug, for instance, has not expired means the strength, the effect may not be there, but it will not constitute danger to the users. So as a pharmacist, you know that better. And that is why in your pharmacy, you may use air conditioners, you use fans and the rest. Whereas somebody who is not aware of this thing, we just, put these things in the hot sun. Like some of the vaccines we use. Let me give example, something like tetanus toxoid vaccine. In some places, you see people keeping these things in the sun. Of course, those drugs would have even expired before the expiry date. Just 3 weeks, 6 months, it has gone. Whereas if it's properly stored, it can be used, and apart from being expired, those drugs will not be dangerous to those who consume them. So as pharmacists know this, non-pharmacists may not know this. Again, I would like to say something here. Our drugs are usually classified, and this is why sometimes people will ask you, can you go for a pharmacist to prescribe drugs for you in the community pharmacy, or people are getting treatment? Of course, that is absolutely correct. People can get treatment in the community pharmacy depending on the kind of treatment they are getting, the kind of drugs that they are getting. If a drug is a prescription medicine, or a drug is a pharmacy only medicine or OTC, the OTC or pharmacy drugs can be gotten, and they can be used to solve health problems of the clients. But the area that I'm trying to touch now is that, let's give this scenario. For instance, you have an aged mother. This aged mother has arthritis, and we know that most drugs used in treating arthritis are OTC. I give example like ibuprofen, aspirin, and the rest of them. And these drugs are gotten without prescriptions. Now, the aged mother you have may also be a hypertensive patient. And so, this mother of yours who is being managed for hypertension, for instance, may have an arthritic pain, and she will go to wherever she can get drugs and to collect a drug known as ibuprofen, for instance. Now, if she takes ibuprofen, for instance, concurrently with her hypertensive drugs, for instance, a drug known as furosemide, is a diuretic. What normally happens, or what really happens, is that drug interaction will poison the kidney. The kidney can be completely damaged by combining a non-steroidal anti-inflammatory drug with a diuretic. But you see, the non-steroidal, which is ibuprofen, for instance, is just an OTC medicine. But the patient will not know, and those who are dispensing these drugs, if they are not professionals, they may be giving the drug with good intention to this mama to handle her pains, but they are causing harm.
But they may not even know that she's on this other one.
Yes, they may not know. Thank you very much. But a pharmacist will ask these questions. And even if they know, they may not know what to do.
Exactly.
But a pharmacist, through questions, will know and know whether to give this or not to give drugs. Yes, and then I also want to give example. When you practice in community pharmacy, you don't know the number of lives you're saving. And for the fact that people go and take drugs probably wrongly and nothing happens to them immediately, people may feel that, no, we can take it, it's medicine, it's not poison as people make us to believe. But let me give example. If a woman, for instance, takes a drug known as dihydrotestosterone, it was commonly sold before now to prevent morning sickness or whatever. If a woman uses this drug, dihydrotestosterone, I can't recollect the trade name now, but it was a very common drug. If a woman takes it today, now the drug has been banned, but sometimes we still see these drugs. If a woman, for instance, takes it, the offspring of the woman, the baby girl of the woman, 10 years later from when the mother took that drug, before that baby was born, the baby will most likely, she will most likely develop carcinoma, that's cancer of the vagina. This is 10 years later. And it will be very difficult for anybody to trace it to the drug that the mother took 10 years ago. You see, so when people take medications, they may not know the harm, which may not happen immediately, but will happen later. But a pharmacist in community will not allow such a thing to take place. So, like we have been saying, pharmacists are saving lives, a lot of people from having problems
by doing the right thing, without knowing.
By doing the right thing. Thank you very much.
Awesome. You have heard from him. He's talked about the public perception. So if you're trying to practice community pharmacy, rest assured that many people may not know who you are, except they see it in the way you comport yourself, in the way you attend to people. And then he talked about knowledge. That's another way you can showcase yourself as a community pharmacist. And he also talked about the layout of a pharmacy. He made mention about storage conditions. And ordinary one would say, oh, well, I don't need to have an AC. Well, I can just arrange my pharmacy the way I like, depending on where I get a site. But maybe where your drugs are stored, there are rays of light coming in, and it's always hot or warm. And then you think it doesn't matter, as long as the drugs are within their shelf life. You've heard from the clinical pharmacist himself that can also make a drug that has not expired by the label, but in itself it's inactive. And then he talks about the fact that community pharmacy will make you keep doing good without knowing, but the goal is to keep doing good every day. You've heard it a lot from the master himself, and I can tell you that community pharmacy obviously is really, really interesting. And I'm thinking that I should just get into community pharmacy practice. All right, sir. We hear clinical pharmacy, and then here we're talking to community pharmacists. Can you help us put together clinical pharmacy and community pharmacy? Perhaps, where's the relevance? Where do they meet?
All right, thank you very much. Let me say first of all, pharmacy is a clinical profession, and pharmacists are known as clinicians. That means they deal directly with patients. This does not mean clinical pharmacist alone. Even operational pharmacist, a pharmacist who is not a clinical pharmacist, is also a clinician. That means he deals directly with patients. Unlike, let me say, something like laboratory practice, for instance, you may collect the patient sample and be using it in the lab. That may not be clinical because there is no patient directly with you, but whereby you also deal with the patient directly. That is clinical pharmacy. And then I want to say this: you don't have to be a clinical pharmacist to practice clinical pharmacy. Almost every pharmacist is supposed to practice clinical pharmacy, because even in undergraduate days, clinical pharmacy is a course in pharmacy practice, or pharmacy school is a course. It's just like, let me use it with let me give example of we in pharmacy, we have twin professionals who are graduates of medicine. You know that if you are to be a physician, for instance, you must study surgery and you must practice surgery. But that does not make you a surgeon. That you can do surgery does not make you a surgeon. So what it only means is that you can do some elements of surgery. Similar thing in pharmacy practice. A clinical pharmacist, every pharmacist can practice clinical pharmacy, but every pharmacist is not a clinical pharmacy. Just like maybe a surgeon will do some advanced surgeries, a clinical pharmacy can also offer some advanced pharmaceutical care. But every other pharmacist, every pharmacist can offer pharmaceutical care or practice clinical pharmacy. Remember that pharmaceutical care is a kind of an offshoot of clinical pharmacy. From clinical pharmacy, you have pharmaceutical care. From pharmaceutical care, you now have medication therapy management and even comprehensive medication therapy management. But putting the two together, as I said, especially a community pharmacist, unless you are into what we call wholesaling and you just want to be a drug-oriented pharmacist. If not, definitely even people will come to you for some health matters and you are expected to solve some of the problem. Otherwise, you will not be doing very well. So that is the area in putting clinical pharmacy and community pharmacy together. In community pharmacy, for instance, you can have what we call community clinical pharmacists. And these people can manage patients or do clinical pharmacy at an advanced stage. But that does not mean that any other pharmacist in the community cannot manage patients, or let's say manage diabetes, manage all these things. Managing disease conditions, or let me say giving treatment, for instance, that is not all about clinical pharmacy. But for instance, in your clinical pharmacy practice, there is what is known as the drug use process. And now the drug use process, you have something like doses of drugs, are they too high or too low? You have drug interactions, drug adherence, you have other drug therapy problems like unnecessary drugs and advanced drug reactions. But then the clinical pharmacist detects, categorizes, or he prevents rather. He can prevent, he can detect, he can categorize, then he can resolve potential or actual drug therapy problems. These are some of the things that a clinical pharmacist can do even in community pharmacy practice. And when you do these things, you discover that you reduce a lot of people from you help people stay out of the hospitals. And even when people are in the hospitals, for instance, the clinical pharmacists can help reduce the length of hospitalizations. So you cannot divorce clinical pharmacy practice from community pharmacy practice. You cannot. It is something you must do. And pharmacy, we say, is not all about drug distribution. That dispensing is part of handing over drugs and probably counseling. These are more of things that any person can do. Yes, these are basic. So that's not all about pharmacy practice. Pharmacists, for years now, they have moved from prescription providers to pharmaceutical care providers. So, and pharmaceutical care, even in our law, PCN law, last year recognized pharmaceutical care. It was never like that before, and all over the world. The pharmacist is a healthcare professional, is a healthcare provider, is a medical professional. And you cannot just, a clinician, thank you very much, you cannot just be giving out drugs, dishing out drugs, and claiming to be a pharmacist.
Okay, so can we say that the clinical pharmacy is, from what you're saying, is what distinguishes a pharmacist today, a community pharmacist, from maybe the chemist, the patent medicine vendors, or just anybody who believes that, just give people drugs as they want? Is it a distinguishing feature, or is it rewarding? And then you talked about something about the extra, that the advanced pharmaceutical care. What exactly what role of the pharmacist can you consider as an advanced pharmaceutical care? Is there something like that? I'm sure our viewers want to know.
Yes, there is something that even pharmaceutical care itself has levels. So you learn of a primary level, secondary level, and tertiary pharmaceutical. Minor ailments, provision, and the rest of them. Maybe something like malaria, all those
That's
things.
on the primary level.
They are still pharmaceutical care. And when you come to, sometimes you can even help physicians to select drugs, from your patient assessments. In pharmaceutical care, you learn more. In advanced practice, you learn more about patient assessment. In fact, for instance, whether you are in nursing, in medicine, or dentistry, for example, there is what is known as IPPA, inspection, percussion, palpation, and auscultation. All these things are also part of pharmaceutical care. Even though, let me say, like, if I would make a reference to medics, for instance, the medics may be using this to diagnose disease conditions and probably prescribe. But the pharmacist, the clinical pharmacist, uses these tools to diagnose drug therapy problems. Because drug therapy, in fact, drugs have been said, or the drug therapy problems have been said to be the third, the highest killer or cause of death, only to cancer and one other condition that way. So this is at an advanced level of pharmaceutical care.
So that's more like an intervention pharmacists do.
Yes.
To prevent avoidable deaths.
Exactly.
In the clinical
exactly.
setting. Okay, that's good. So let's look at what then now can you say are those benefits for practicing clinically, for imbibing clinical pharmacy practice in the community setting? What are some of those benefits? I'm sure our viewers want to know.
The benefits are enormous, as I've said. Number one, the society will recognize you as a healthcare professional.
Very important.
Yes. Number two, you will help save lives. You may even help save lives of your family members and loved ones. So you really need to practice clinically and know the right thing. And then it will also put food on your table. You will not become poor poorer because you're practicing clinical pharmacy. Rather, you become richer because you are adding an added value. Yes, added value. You are adding value, and you're providing solutions. And people don't pay for services or so, but what people pay for are for solutions. So if you provide solutions, but sometimes some persons don't want. Some persons will say, "How will this transcend to food on their table?" Like the Holy Book say, "Seek ye first the kingdom of God, and everything will be added." If you start pushing money first, you are not likely to even see the money, but rather do the right thing. And this is the way it is being done all over the world right now.
And I think that's again, some other persons would say, like we've heard from some people, that also gives a better image to the profession. I don't know if you also share that view, that when we practice clinically, does it have any positive effect on the pharmacy profession, the way people see pharmacists?
Yes, like I said, some people, before now, some persons, if we say you are a pharmacist, the first thing some persons will ask is, where is your shop? That means you're selling drugs. People don't even know that.
Trader.
Yes, you're a trader. People don't even know that you work in the hospital beside the patient, on the patient's bedside. You help physicians and nurses, even in both solving drug therapy problems. Exactly. So pharmacists work in the wards directly, not just dispensing drugs. And some clinical pharmacists may not even touch drugs, or they may not even be drug dispensing. So that is one aspect of it. Then secondly, the government too is there. For sometimes, like we talk about consultant pharmacists, you can be a consultant pharmacist, even in community pharmacy practice. You can be in the hospital, but you can't just be giving out drugs, what we call drug distribution. You just give out drugs and you say you're practicing pharmacy. That is not pharmacy practice.
We've gone beyond that.
Pharmacy practice is beyond that. Yes, as you have said. So this will better the image of the profession, and wherever you are at any moment, you are a problem solver.
Exactly.
Not somebody who is just you have gone to school and you stop practicing.
You're just there to make money by selling drugs because you know people need them.
That's not very wrong. That is very wrong. And please let me add this. Sometimes we discover that, like I said, those who stop reading, it's not even only stop reading. Those who stop practicing, they start dying. Because if you're not practicing, you will not, they say practice makes perfect.
And you won't get evidence-based knowledge.
Thank you. Before you know it, you don't know anything again. And that is not too good for pharmacy. So we encourage all community pharmacists to practice clinically. That is the way to go.
All right, practice clinically, that is the way to go. You can see that practicing clinically makes you unique, makes people trust you more, of course, puts food on your table, and also gives a better impression about pharmacists to the larger society and to the government. So these are the words of Dr. Joseph Madu. We go on another commercial break, and when we come back, we will be looking at something that is cooking real hot from the stables of the Clinical Pharmacist Association of Nigeria. Don't go away, we'll be right back.
This episode is proudly supported by New Heights Pharma Limited, official business partners for Omron Healthcare Europe, and the owners of the Health Check brand in Nigeria. Do you know that with just one test cassette, you can get tested for HIV, hepatitis B and C? Oh yes, with the Health Check HHH viral test cassette, knowing your status is easy and stress-free. It is simple, quick, reliable, with over 99% accuracy. Order for your pack of HHH viral check test cassettes at the pharmacy near you today, or call the number on your screen.
Welcome back. It's still the Community Pharmacy Accelerator Show, and we are here with Dr. Joseph Madu, Dr. Sir Joseph Madu. And of course, we have been talking about clinical pharmacy and community pharmacy, and we've been able to establish a link and even the benefits of practicing clinically in the community pharmacy setting. Now let's go into something that is cooking real hot in the CPAN, in the Community Pharmacy Association of Nigeria space. And that is the forthcoming and maiden edition of the CPAN conference. And I'm sure our guest today is really very excited. What started just barely 2 years ago as an interest group has gotten to the point of having her first conference. So tell us, how do you feel about this conference, and what is this conference all about?
All right, Joe, thanks for giving me the opportunity to talk about CPAN National Conference. That's the Clinical Pharmacist Association of Nigeria Conference. So I said national, not national conference, but an international conference. CPAN is an international scientific and professional pharmacy association domiciled in Nigeria.
Okay.
CPAN is the first of its kind in West Africa, meaning that there is no other type of such association. There is no other clinical pharmacy association in West Africa. CPAN is the first. Although in Africa, we have one from South Africa, which is South African Society of Clinical Pharmacists. Then in UK, or yes, in Europe, we have European Society of Clinical Pharmacy. UK precisely, you have UK Clinical Pharmacy Association. And in the US, you have American College of Clinical Pharmacy. It's known as, it's a college, but it's not a school. It's just a college, an association of clinical pharmacists. So in West Africa, Nigeria, the giant of Africa, happened to be the first to inaugurate this kind of clinical pharmacy association. The major aim or goal of the association is to advance direct patient care, as we have been saying, meaning you and the patient directly, not indirectly. Direct patient care through clinical pharmacy practice, research, and education. So these are the things that happen in CPAN. So for the first time in West Africa, the whole of West Africa, precisely Nigeria, clinical pharmacists will be gathering to have a conference.
Wow.
It has not happened before now. It's maybe in UK, as I said, or even in Saudi. Saudi Arabia have Saudi Society of Clinical Pharmacy. But for the first time, it will happen in Nigeria. It will happen in May, in the month of May year 2023. Clinical pharmacists in Nigeria and the diaspora, because as I earlier explained, that CPAN is an international body, even though it's domiciled in Nigeria, formed by Nigerian clinical pharmacists, and is owned by Nigerian clinical pharmacists. That is why it is an interest group of the Pharmaceutical Society of Nigeria. But because members from different countries, as I speak, we have members not only from Nigeria, we have our diaspora arm, and there is good news that even as we are planning this conference, the diaspora members of CPAN from US, UK, Saudi Arabia, India, Pakistan, we have members. They have come together and they told us they are also putting something together to make sure that this conference becomes a success. So that is to tell you the reach of the association, and it is interesting, it's exciting, it's fascinating. Before now, sometimes some of us may go to FIP, and we are proud to say that we are going on FIP, which is an International Federation of Pharmacists. Their conference, of course, is an international conference. But this is like what you go for in Sokoto before. You cannot see it in your Sokoto. So even in Nigeria, you don't need to go to
that people will come.
That people from outside.
That's marketing Nigeria.
In fact, one of the speakers I dare to say is the immediate past president of Nigerian Association of Pharmacists and Pharmaceutical Scientists. He's already one of the speakers, and he will be in Nigeria. And there are other persons too that will also come from the diaspora. So one good thing there is that it has an international covering or international basis. Since we also have international members from different countries. Then besides that, other benefits that people will get, we are organizing some skills, some trainings. For instance, there will be training on something parenteral drug utilization, and then there will be something on some practical first aid skills for pharmacists. Some of these things are things you can take back to your practice after the conference, and these are hands-on skills, not just theoretical. So you look at the demonstrations, even though there will be some online trainings before then, you have something, and tomorrow you can say, yes, I can do this. much more effectively. It's not just,
it's not just a conference.
Thank you very much. Yes.
Cheap drugs and interact.
Thank you.
There's something to go home.
Thank you very much.
Awesome.
And you will still be meeting with your colleagues, clinical pharmacists from different states in Nigeria and from other parts of the world too. It's going to be great. I believe things like that are highly beneficial. Apart from that, there will also be some renowned speakers who will be there to share their experience. And then you may ask, why have we chosen Akwa Ibom State, Nigeria? A lot of factors came into it. Definitely, we know we'll go to other states after this, but you will agree with me that there will be relaxation. Akwa Ibom is one of the places that people go for tourism. So you can take it that you're also going for tourism.
It's a time to relax as well.
And you enjoy their delicacies.
Oh, yeah. They say Akwa Ibom is the land of soups. Are we going to be having some scientific soups? Wonderful.
Yeah, I don't know if it's scientific, but I know they have a lot of soups.
Well, you've heard it that there's going to be some clinical pharmaceutical soup as well as other research. You heard that from me, but don't quote me. However, it's the first international conference of the Clinical Pharmacist Association of Nigeria. And you have just heard that this association is the first of its kind in West Africa. And it's also another way to showcase the brilliant disposition of pharmacists in the healthcare sector. There's no other place to be in the month of May other than obviously to be with the CPAS members and of course her other associates and members in diaspora in the city of Uyo, Akwa Ibom State, South Nigeria. Of course, we are going to be putting up some details of this conference on the screen. We encourage you to keep a date with CPAS in May, right?
Yes.
Yeah, where the conference is going to hold. And we hope you've been blessed by this episode of the Community Pharmacy Accelerator Show. And just before we go, we always give our guests the opportunity to give some parting words to our viewers. So what words do you have for our viewers in 1 minute? Thank you.
Okay, viewers, I will still say thank you for your time in listening to us. Pharmacy is a great profession to behold, and for community pharmacists in particular, clinical pharmacy is the way to go. Don't get obsolete. Thank you very much.
All right, thank you very much. It's been a wonderful time. Clinical pharmacy is the way to go. I'll see you in the next episode. Thank you for watching today's episode. We hope you enjoyed it and you learned something great. If you did, please drop a comment on the comment section. And if you have any question, feel free to post it on the comment section. Our resource persons will be available to provide answers to your questions. Remember to contact us for any inquiry, sponsorship and advert via the contacts on your screen. Remember, until you take new and better actions, you will never see new and better results. Goodbye for now.